All right. Hello, everyone, and welcome. So my name is Selena Lau Mason, and I am a program manager with the UCSF California Preterm Birth Initiative. I'm so excited to be here. You've probably seen my name a lot because I've been working on these collaboratories for the last handful of years. So it's great to be with you. If this is your first event with us, we welcome you to join us at our monthly collaboratory series to think through and generate new ideas, collaborations, and innovative approaches to preventing preterm delivery and improving outcomes for babies born too soon. You can follow us on TikTok, Instagram, Twitter. There'll be links in the chat. We are also having this event be co-hosted by Expecting Justice. Expecting Justice is a Black-led collaborative mobilizing leaders from across San Francisco to take action to improve preterm birth in Black and Pacific Islander communities of San Francisco. You can see their focus areas on the screen. They are amazing. There will be links in the chat to their social media, their website to learn more and get plugged in with them. So before we begin today's session, we want to start with an appreciation of our Black ancestors and a land acknowledgement. We acknowledge the exploitation of the enslaved Black people who toiled on this land, building America's wealth and freedom, and survived despite never being compensated and being denied their sovereignty. We honor, remember, and acknowledge those whose legacies were cut short due to the genocidal anti-Black violence. And we acknowledge that we have benefited from their sacrifices. We are working to repair the harms caused by individuals and institutions and the US government, and are committed to equity and reparations. And we honor the gifts, resilience, and sacrifices of Black Americans, past and present. We would like to acknowledge the Ramaytush Ohlone people, who are the traditional custodians of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. Thank you so much for joining me in this reflection. In every collaboratory, we also share an organizational highlight, and today we want to spotlight the Lactating Mama, founded by Trina, a Black breastfeeding mama with 2 children. They provide lactation education, consulting services, and products that help support and encourage the journey of every breastfeeding mama. So we encourage you to learn more at their website. The link is in the chat. They have a ton of tools, resources, answers to hard questions. They have breastfeeding diaries with stories from moms. You can shop their Lacti cups, bracelets, other swag. You can donate, you can get a consultation. Really, really thankful for the Lactating Mama. And with that, I want to give a huge thank you to our panelists who are here with us today. Thank you, Robbie Gonzalez Dow, Selah Steiger, Akila Russell. Before we get into the panel, Joe and Peja will be sharing a short presentation to ground us in the landscape of breastfeeding disparities. So I want to introduce them, our co-hosts, co-moderators, our partners. Joe Williams is an advocate, researcher, and artist who is deeply dedicated to racial equity and the liberation of people with mental illness. As a proud alum of Stanford University and a newly minted Cal alum, Jo is, in her words, a house divided. Her lived experience in the foster care system informs much of her politics, study, and advocacy. Peja Edwards is a women's reproductive and maternal health advocate, certified lactation education specialist, and birth doula. She has over 6 years of experience in healthcare administration and public health, working with historically oppressed and marginalized communities, describing herself as a lover of laughter, joy, and self-expression. She hopes to spread more love and light to the communities she serves. And then I've already introduced myself. Hello. The link to our full bios will be in the chat. And without further ado, I want to welcome Jo and Peja. Thank you so much.
Hello, everyone. Thank you for that lovely introduction. So yeah, before we get into our case study and the journey of our mama that we'll be featuring, I wanted to center ourselves in the statistics and kind of give you a snapshot of what's going on when we think about Black breastfeeding. Next slide, please. So here we have a snapshot of different counties throughout California. This is from the MIHA data from, I believe it was 2016 to 2018. And so we have some various counties here, LA County, also in the southeastern region, and SoCal, Imperial, Riverside, and San Bernardino, and as well as all of the Bay Area counties grouped together in a region. And so this snapshot really features self-reported data about any breastfeeding 3 months postpartum. And so across the board, we can see that unfortunately, Black folks, Black mamas, and birthing people are reporting the lowest rates of breastfeeding at any point 3 months postpartum. And while the numbers kind of range, we can kind of see that here in the Bay Area, in terms of Black mamas, we're actually doing better with 69.3% of Black mamas reporting breastfeeding 3 months postpartum. Thank you, Peja. MIHA stands for Maternal Infant Health Assessment. Thank you for that. And so, yeah, this is just kind of giving us a general snapshot. And then next slide, please. And so when we focus in on the city and county of San Francisco specifically, we're still unfortunately seeing these racial disparities with Black mamas and birthing people reporting the lowest rates of breastfeeding 3 months postpartum. And so, as always, these numbers are numbers and they give us part of the story, but not the full story. And so it's really important that when we're thinking about behavioral change, we're also thinking about intent. So if you can go to the next slide, please. So this slide is really important. This is from national data in which WIC, or Women, Infant, and Children, recipients from across the US gave self-reported data on breastfeeding intentions. And so we can see that when we look at, what are the mamas intending to do right before they give birth, we actually see that both Black and white mamas have very comparable, if not almost the same, right, intention to breastfeed. And so then the story gets a little more complex, right? And next slide. And we start to look and kind of wonder, right? So we have these comparable intentions of breastfeeding, but once the babies are actually here, only 67% of the Black mamas are reporting that they actually have breastfed 3 months postpartum. And so again, this is really important for us to consider what is actually happening postpartum after delivery, such that only 67% of Black mamas are breastfeeding. I think that this gap between intention and postpartum is really where public health can do its best work. How can we make sure that these mamas are able to have this lived experience that they're hoping and intending to have? And so I'm going to be passing it on to Peja, who's going to really just explore, so what are these barriers in our environment that Black mamas are experiencing such that they're not actually able to breastfeed like they intend. Next slide.
Thank you, Jo. Appreciate that. Yeah, so we really want to get into systemic barriers to Black breastfeeding. So often we just present on the disparities and, The hard part about quantitative data is that it often moves us into a space of victim blaming, right? And blaming the individual for disparities that are completely and totally out of their control, when in reality, these disparities are the result of systemic barriers, right? So we're going to review some of those systemic barriers and then also talk about some benefits, right, to improving Black breastfeeding rates. So one of the systemic barriers to Black breastfeeding is structural and institutional racism. So when I say structural and institutional, I mean systems, right? I mean the hospital system. I mean, I'm talking about work environments, right? Job, places of employment. I'm talking about societal systems, right? I'm talking about the school system, right? I'm talking about all the systems that be, and I'm also talking about policies, right? And the policies that make it harder for Black mothers and birthing folks to breastfeed. There's also an issue of shorter duration of maternity leave. As we all know, or a majority of folks know here, the United States has one of the shortest durations of maternity leave among developed countries, right? And then we also have a lack of support in the workplace. Very few jobs, although in California in particular, right, there are certain laws and policies, which of course our panelists will get into later, although there are certain laws and policies that say it's required and mandatory that employers provide a space for mothers to pump, to breastfeed. A lot of employers don't do that, right? So there's a lack of support in the workplace. And there's also this thing known as a first food desert, not to be confused with fast food desert, right? But a first food desert. And what that means is that we have mamas that are in these, it's making it harder for them to actually, when I mean spaces, I mean their actual physical built environment. So, do they have resources? Do they have access to culturally concordant lactation consultants? Do they have access to primary care providers? Do they have access to prenatal postpartum care, right, to help them learn how to breastfeed? A majority of these mothers don't. So we have first food deserts. First food means human milk. Then we also have homelessness and housing instability. Black folks have higher rates of housing insecurity in California. California has a very, very, very expensive cost of living, right? And because of those reasons, and also because of the racial wealth gap, we see that a lot of Black mothers have homelessness and housing instability. A lack of culturally concordant care. I said it before, but a lack of folks who look like me, who understand my story, who understand my history. Not only that, evidence shows us, right? Like evidence shows us that when someone looks like you, they care for you better. You receive a higher quality of care, not just because you have the same skin color as me, but because you understand my experiences. You can speak my language. You understand where I'm coming from. You're not going to recommend things that you know that I don't have in my community. You're going to be a resource for me, right? And then also the enslavement history of wet nursing. Some may know, some may not know, but there is a negative connotation sometimes within the Black community when it comes to breast and chest feeding because of enslavement, in which Black women and birthing folks were forced to breastfeed their white masters or their white enslavers' children. So there's that connotation that's attached, but once again, it's of no fault or result from actions of Black mothers and birthing folks. Next slide, please. Okay, so we're going to head into some breastfeeding benefits. Some of this may be what you know, some may not, but we're going to head into the next slide, please. Thank you. So breastfed infants have a reduced risk of asthma, obesity, type 1 diabetes, and this is not an all-encompassing list by any means. They also have a reduced risk of severe lower respiratory diseases. This especially comes and plays a part with babies who are born too soon or babies who are born prematurely. They have a lower risk of sudden infant death syndrome, and they also have a lower risk of gastrointestinal infections. A lot of times newborn infants have a hard time breaking down things, but human milk actually helps to improve their gastrointestinal structure. Next slide, please. And breastfeeding is also linked to a reduction in high blood pressure, type 2 diabetes, ovarian cancer, and breast cancer. A lot of times folks don't even realize that, breastfeeding also has positive impacts on the breastfeeding person or the breastfeeding mother as well. Next slide. All right, so something that is often not explored are the societal impacts of improving breastfeeding, but especially Black breastfeeding. A lot of times people think of breastfeeding as a siloed event, right? And not only that, but that siloed event only impacts the infant. Now, of course, the infant is of utmost concern and actually at the top of our list. However, as I said earlier, just a slide ago, right? The mother and, breastfeeding person also has, there are also benefits associated with breastfeeding for them. There's also benefits associated for the entire society. And some of those fall within the realm of health and well-being, which I covered a lot of those prior, social capital, and also community. And I'm going to get into that in the next slide. So this is actually a one-pager from the Black Mothers Breastfeeding Association. And what I love about this one-pager is that they really break down the societal impact of improving Black breastfeeding, right? And understanding that breastfeeding isn't just a siloed event. It's not just about feeding babies. So that is very important, right? It's not just about that, right? Because babies win, right? Babies are less sick, right? They're less likely to develop certain infections, right? Which means that they are, set on a path to be functioning, better functioning members of society. They're set on a path to miss less days of school because it's, keeping them from infirmity like obesity and asthma, right? And also families thrive, right? It helps to keep the family close. It cures them, it provides a warm, comforting environment. It helps the mom and the birthing person with postpartum weight loss. It keeps, the mother healthy too. Like I said, it helps to reduce breastfeeding. It helps to reduce breast cancer rates as well among the mother. And then communities are vibrant, right? It literally saves lives, right? Because it's reducing infirmity. And then it also results in fewer absences from work and from school, right? If we're setting these infants up at an early age, right, to not be predisposed to certain health conditions, right? And that means they're going to be better, right? Better equipped to go on and to be full members of society. Not only that, it helps to reduce costs, right? Like if you are able to feed an infant from your body and instead of purchasing formula, right, you are reducing household costs, which means that there's more money going into your pocket, which means that there's more money to spend within the larger community, right? And then it's also environmentally safe, right? So not only is it just a benefit to the family and to them, to the family, and also when we're thinking about the school system and the work structure or the work environment, it's also a benefit to the environment in that people are going to be utilizing less formula, which means that there's less waste, right? Some folks who choose maybe not to bottle feed, right? They're utilizing less bottles, which are typically made of plastic. That's not going, adding to the pollution that we already have in California and then the United States worldwide. And I just want to wrap that up with saying that, when we're thinking about breast and chest feeding, we're not only talking about one siloed event. We're not just talking about, the infants. We're talking about the mother. We're talking about the family. We're talking about community. We're talking about the society at large. Next slide. All right. Yay, our main event. So you want to introduce?
Yes. Thank you so much. Thank you so much, Peja and Joe, for that grounding. We're going to launch into our case study next. So we will be following Kayla's breastfeeding journey. Kayla is a Black woman who has just given birth and is a first-time mom. So we're going to have 4 scenarios, and we will present. We're going to ask you all, our audience, to engage with us in the chat. And we will also have some questions for you to think about and respond to with that. And then we're going to turn to our panel of experts to hear what actionable solutions they would propose. That can include kind of what was done well or what should be done differently, what opportunities there are for policies to be implemented, and maybe what resources could be utilized. And so we are really lucky to have our panelists here with us today. I'm going to introduce them. We have Selah Steiger, who is a staff attorney at Legal Aid at Work in the Work and Family Program. She provides legal advice and representation to pregnant workers and new parents, workers struggling with family and medical crises, and survivors of domestic violence and sexual assault. SALA also presents trainings on new parent and caregiving leave laws and engages in policy advocacy to advance the rights of working families. Akila Russell is an international board certified lactation consultant and childbirth educator who advocates for reproductive justice and the rights to an equitable birthing experience. Akila has over 15 years of experience working within her community. She's a longtime advocate, supporter, and friend of Breastfeed LA. In her private practice, Nenny's Lactation Consulting, she provides compassionate and empowering breastfeeding and childbirth support to families. As a mother of 2 breastfed children, she understands the importance of promoting breastfeeding as the optimal feeding choice for infants. We also have Robbie Gonzalez Dow. She is a registered dietitian and certified lactation educator and has been supporting and working with the California Breastfeeding Coalition since the very beginning. Robbie is a seasoned public health advocate with many years of experience in grassroots engagement, community organizing, and media advocacy around nutrition and breastfeeding issues. She is extremely passionate in forwarding action to remove barriers and to breastfeeding so that mothers can fulfill their breastfeeding goals. So with that, I want to hand it over to Peja for our first scenario.
Thank you, Selena. Okay, so we have scenario 1. And the scenario takes place at the hospital. So we have Kayla, a Black mama, who has given birth at the hospital and is trying to get culturally concordant lactation support. And trying to obtain help, Kayla experiences medical racism, specifically assumptions about breastfeeding in the Black community. And this is what it might sound like. Gotta love Zoom. Thank you, Selena. Okay, so we are going to be going through, right? We really want to immerse ourselves in what this may feel like for Kayla, our Black mama in this situation. So we're going to talk about what it sounds like, what it looks like, and what it feels like, right? So what it might look like, so you heard what it might sound like, which, you know, if for those of us who have ever been in the hospital, that beeping noise from the machines, right? Sounds all too familiar. What it might look like, you know, are the nurses grabbing the mama's breast or nipple without permission. And I also want to preface that in this space, we're utilizing the term mama as an umbrella term for those who give birth, who identify as a woman, and also those who identify as non-binary and trans as well. And it might also look like a nurse bringing bottled formula to her room without a conversation. So just assuming, right, that she's immediately going to be formula feeding her child from a bottle. Next slide. What it might sound like, these are direct quotes, right, of what it might sound like from providers and clinicians in the hospital. Oh, you're having trouble latching. You should give your baby formula to make sure they're getting nourished. Well, you know, it can be hard to juggle breastfeeding when you have so many other kids and you're a single mother. Your breasts and nipples are too big for your baby's little mouth. So you'll probably have a really hard time breastfeeding and need to switch to formula. Now, and also realizing that some of these terms or some of these quotes may be triggering for some, as well as some of the sounds like, you know, and also feels like. So we also want to censor that. And if you need to take a break or excuse yourself, please do so. Next slide. And what it might feel like for the mama, right? These are feelings that our mother Kayla may be feeling. She may feel exhausted from labor, but excited to have her baby in her arms. You know, I'm anxious to get the right latch and feed my crying baby, right? I'm in a space that has historically harmed Black people and not sure if I will get equitable care. I'm guilty. I feel guilty when nurses imply that refusing formula is starving my baby. This is why we wear glasses. Next slide, please. All right, so we want to put this to our guests who are joining us before we head into our panelists. Share in the chat. What would you tell a mama who was hearing some of these things from providers? And you can go ahead and drop that in the chat and we'll share out. And also, what would you tell the providers, right? So it's not just about what would you tell the mama, but also what would you tell the providers? And we'll continue to look at those and read those out. I'll give you guys maybe like 60 seconds to drop some suggestions in the chat, and then we'll head into some input from our panelists. Okay, we have Dalvery. I hope I pronounced that correctly. She says that for the mother, she would say see community-based support. All experiences are different. Yes. Beatrice says your feelings are valid. Absolutely. Joe says I would give the mama encouragement that her body has what her baby needs. Absolutely, Joe. Maya says for the mom, you can do this, mama. Find some support, love. Clem, the doula, says, ask if they have any resources for Black breastfeeding support. Love that, Clem. Ellie says, or Elle says, your fears and worries are valid. I'm sorry you did not receive the care you deserve. I can direct you to some resources if you like. I love an actionable solution. Veronica says to the mama, I'm so sorry for your experience. You are not alone, and I thank you for sharing. You are doing a great job feeding your baby from your body. How can I support you? Yes, actionable solutions. And one more from the provider, enroll in culturally competent training. And that is, yes, very true. Thank you, Lisa. We're going to go ahead. Please continue to drop those in the chat. We are definitely reading them. We're going to go ahead and move forward to our panelist input. So I'm putting this to the panelists now, right? So what are some things that could have been done differently? Panelists, Sayla, Akila, and Robbie, what are some things that could have been done differently? Or what are some actionable solutions that the hospital can imply to make this story look different for this mama?
I can start off by saying that first and foremost, I appreciate that we're doing these scenarios. And although these are, I don't want to say fictitious scenarios, because for me, this is a reality. I gave birth in a hospital as a Black woman. I have 2 children, both in which I breastfed, but my situation looked like the scenario. And it's because the institution where I gave birth really only supported 3% of the Black population within my area. And so with that being said, it was basically just a stereotype. The majority of those mothers were not breastfeeding. I know that now because I work with those hospitals at this point, but they are just so used to the moms not breastfeeding that it was just considered or assumed that I would be doing the exact same thing. The exact words that were presented to me was, your baby's starving and you definitely don't want that, right? You don't want to starve your baby. And for a first-time mother who's very vulnerable, laying on a table, of course I don't want to starve my baby. I think one of the biggest things is that what we're looking at is that people are trying to gain compliance through fear versus collaboration, which is really important. And so as opposed to like understanding where am I at within this breastfeeding journey, it was to fearmonger and say, no mom wants to starve their child. So she gained my compliance by scaring the crap out of me, basically, because I'm going to do what's best for Noah. Luckily for me, at my side, and this is why the village is so important, and this is why the sisterhood, whether it's your mother or your sister or a doula or anyone on this call that's supportive, my mother was there who had breastfed 9 of her own children and understood what actual normal newborn infant behavior looks like and what breastfeeding looks like. So that was a great support system that I had. But not everyone has that. Not everyone has the mother, the sister, the aunt or the grandma that breastfed, because they did not receive that support in the hospital and they just became another statistic.
Thank you.
Wow.
Sorry,
you had that experience, Akila. I come from the lens of looking at the system. And so we do have laws in California now that require hospitals to implement policies and practices that support families with breastfeeding. Because as you saw at the beginning, we have very high initiation rates. Families in California want to breastfeed. And I'm sure that's the same in other states as well. And so they have to comply with implementing the new policies by 2025, but they've had since 2013 to do this. In fact, all hospitals have to have an infant feeding policy. Families can always ask ahead of time. can I have a copy of the infant feeding policy? What can I expect? Like, has all your staff been trained? Can the bedside nurse help me? Do you have lactation staff? Are they 24 hours, 7 days a week? Preparing to know what the situation is in that hospital, because unfortunately they do operate differently in maternal care, and they really can make up the rules. So
Unfortunately.
so those things will help set up those expectations of what is available, and to set yourself up for the support that you really need. But I think at the community level, start asking the hospitals those questions. Can we see your infant feeding policy? Take a look at it, read it, become a partner with that hospital. How can it be improved? Is it serving the community as we really want it to serve our community? And, the rates do show us, they tell a story too, not the whole story, but they do tell a story.
Absolutely. Thank you.
And I put the link in the chat to all the laws that apply to California hospitals around lactation.
Thank you, Robbie, for that resource. Appreciate it. And for your input. Taylor, I didn't know if you wanted to add something more.
Yeah, I'll just add something very quickly. Really appreciate you, Robbie, for sharing those laws too, and for your experiences, Akila, as well. I just wanted to add that, of course, Kayla during this time should be focused on this and not on worrying about work or anything like that. And so I just wanted to mention that she likely and should be qualified for job protected time off while she is giving birth and recovering. So her job should be protected and she will be able to return to her same job after recovering from childbirth. As well as during that time, if she's paid into the fund, she should be eligible to get payment through the state disability insurance program. So those resources are available so she can focus on her baby.
Perfect. Thank you for that. That's so important. A lot of folks don't know that. So thank you for adding that, Selah. And I have a few follow-up questions. Like, this conversation is amazing, first and foremost. Thank you all. I have a follow-up question specifically for you, Akila, and then specifically for you, Robbie. So I'll start with you, Akila. So in the scenario, there was a specific where a nurse or a clinician was telling the mama, you're not going to be able to breastfeed your baby because your nipples are too big. Right? Like, and your breast is actually too big for your baby's little mouth, right? And I feel like that's something that I've heard. I myself am a certified lactation education specialist. I actually trained with Akila, everyone who didn't know. Like, everyone here didn't know, but anywho, but that's something that I've heard a lot. And I was wondering, Akila, could you speak to that a little bit? Just like a lot of those stereotypes and those myths that are out there specifically about breastfeeding.
Certainly. And this is not to like box everyone, but African-American women can have a larger anatomy of breast. And so if you've worked in lactation, or if you're an educator, or if you've been in this space at all, you have heard the age-old saying that it's not nipple feeding, it's breastfeeding. So it does not matter how those nipples look, whether they're long, short, round, perky, whatever, the baby really needs to bypass the nipple altogether and latch onto the breast. And so when you say that your nipples are not good enough, what you hear is that you're not good enough. Your breasts are not good enough. Your milk is not good enough. So therefore you can't do it. And what is your alternative? Because it's available, it's to switch to infant formula. And so what should have taken place is to really assist the mother in latching her baby, right? Because it doesn't matter. Your breasts are designed to breastfeed your child, and it is the only breast that they will ever know. So it's perfect. The baby will learn how to adjust, will learn how to latch based on whatever anatomy that mama has. You name it, I've seen it all. I've seen like all shapes and sizes. And sometimes I'm like, you know what, we might need a little bit more work. It might need to be a little bit more hands-on, but we're supportive, and we're certainly not like highlighting anatomy in breastfeeding. That should be the last concern, unless it's something that's posing an issue with milk supply or something like that. But the anatomy, it really doesn't matter for the breast. That's just another tool or mechanism or statement, blanketed statement, to get the person to believe that they, as a woman, as a lactating individual, is not able to do this for their child.
Thank you. 2 snaps and a clap to everything that you said, Akila. Thank you, and really appreciate you speaking to that. My follow-up question for you, Robbie, and then I'm going to wrap up after this. I'm just really excited about this conversation. But my follow-up for you, Robbie, and you talked a lot about where you spoke to the policies and specifically the policy that all hospitals in California are supposed to adhere to by 2025. And I know the way that policies are set up, but I want to ask you specifically, you know, with your level of expertise, what do you think are the strategic steps that hospitals should be taking to make sure that this plan, right, and that they're in alignment by 2025? What are the things that hospitals can start to do? A lot of times you hear administrators say, well, this is too much, and I have other things to worry about, and it's the pandemic, right, and it's COVID, and I have all these other things, so you're adding something else to my plate, and this is too big, you know, of a thing to tackle, right? So what are some actionable steps that hospitals can start taking to implement this by 2025?
Well, they can start looking at their current infant feeding policy and is it up to date? Is it current with the current 10 steps to successful breastfeeding, the baby-friendly hospital initiative? Because it did change. And there's a lot of resources for hospitals, but it needs to be continuing quality improvement. It's not like we've done this and now we're done. It needs to be continuous. And so they need to set up systems within the hospital, having a committee, a task force. In the policy, it should say who's responsible for that. How often do they update their policy? So it's within that policy, and that's what should dictate how they operate, but continuous.
Thank you. I love a good continuation, continued care plan. So thank you, Robbie. So I'm going to go ahead and pass it off for the next scenario. Thank you all for participating in this. I'm going to go ahead and pass it off for the next scenario.
Awesome. Thank you to the panelists and Peja. I'm so excited to talk more about Kayla's journey. So this is scenario 2. So this is like right after our mama, Kayla, has come home from the hospital. So it reads, this is about at-home care. So Kayla has been discharged from the hospital and she's having a hard time breastfeeding. She has sore and bloody nipples and is experienced prolonged engorgement. So when that happens, she reaches out to her OBGYN and her primary care physician, and they both advise that she should reach out to her insurance to see if she can get some in-home lactation support from either a CLES or an IBCLC or so, a certified lactation education specialist, or I think it's like internationally board certified lactation consultant. There we go. Always a mouthful. They do amazing work. And people should have access to them. So therefore she calls her insurance company to see if she has in-home lactation support. But unfortunately, she learns that she is not covered under her insurance. Thanks, Selena. So I think we can all think of a time where we have been on hold for a very long time and we really need help. And so this is the kind of situation that our mama finds herself in when she has a newborn and is experiencing physical and probably mental distress as well. So what does this look like? This looks like the mama checking her insurance plan coverage while also trying to feed her baby. So you can kind of see in the our wonderful illustration to the right of like being on the phone and that being very frustrating while also trying to attend to a little itty tiny baby who's probably hungry, right? So the mama is also frustrated and crying because she feels discouraged and unsupported by these systems that are meant to hold her. And also just being put on hold by the third representative after really long wait times. It's just, I mean, it's frustrating for everyone. I think everyone can identify with the angry character at the bottom from one of my favorite movies, Inside Out. So next slide. So what does this actually sound like? Because we're really trying to put ourselves in the shoes of our mama, who again has a newborn like on her chest. And so it's like listening to hold music that sounds like just really egregious, don't want to listen to it. It looks like hearing things like you would need a different plan to receive that kind of support. Let me transfer you, and hearing that several times. We don't cover that here, or you'll likely have to pay out of pocket for those services. Next slide. So what does this feel like? Again, centering ourselves in what it might feel like in the body to be on hold while your baby's crying and you're in physical distress. So you might feel anxious to get the right latch and make sure that you're feeding your baby who's crying. Maybe feeling hopeless because overall you're feeling really unsupported. And then as a mother, having that fear that, is the baby getting enough milk? Because if I'm trying to exclusively breastfeed and it's painful and it's just not really seeming to be successful, like how am I supposed to know if my baby's getting enough food? And how long, can I persevere through this? And as someone said in the chat from La Luna, I would definitely feel overwhelmed. And I mean, I feel like just reading it off just feels overwhelming. So yeah, I would love for people to share in the chat what kind of like tips and supports would you offer a mama who is in physical pain, remembering that like her nipples are bloody, that she's experiencing engorgement, and she's just in a lot of pain. So in the chat, we have some definitely empathy for Kayla, how she might be feeling overwhelmed. Also breastfeeding support groups that she might be able to access. So that's really important too, because like how Peja was saying earlier, because of these like histories of oppression and specifically slavery and milkmaids and everything, having that, it can sometimes be difficult. Some of us do have mamas who breastfed us, some of us don't, right? So being able to access that like communal support, we might have to go out of our family to get that kind of lived experience and knowledge, and that should be available for us. And then also the other question too is like, what would you tell the providers and the insurance company in response? Like, what solutions, what ideas might you have so that, a mama with like a newborn wouldn't have to wait so long to get her answer? So in the chat we have, so from Julie, find out if there's an outpatient lactation clinic and that her insurance will cover. Also baby cafe or WIC peer counselor resources. So at the end of our presentation, we're going to be giving out some of our local resources, but what comes to mind is like Breast Friends, which is mainly in the East Bay, but also does some work in San Francisco as well. That has these supportive groups that are available for our mamas out here in the Bay. From Dalvery, some messaging to the mama: you're an amazing mom. We know you desire the best nutrition for your baby. Let's find a community-based lactation consultant who can see you ASAP in your home. So I'm seeing a lot of things like referrals to culturally specific breastfeeding experts, referrals from Suzanne from SF WIC and IBCLC can go to her home and help her within 24 hours. So this is a resource that can actually help some mamas in our community now. And La Leche League is also free. So again, at the end of the presentation, we're going to talk some more about resources, but continue to put them in the chat and we'll make sure that people have access to them. So thank you, Selena. Now we're going to move on to the panelists' input. Just to start off, I'd love to just hear anyone's just first reaction to this experience of a mama needing in-home support and ultimately finding out that she can't access that through her insurance.
Yeah, you want to go, Akila? I just want to say that right now I feel like this whole area of insurance, having that as a benefit, it's in the federal law and it's just a mess. It's not working right now. So they're supposed to require, so in the ACA, when the Affordable Care Act passed, it included provisions for women's preventative services, guidelines that require health plans. So health plans to cover preventative services for women, including comprehensive breastfeeding support and counseling. And people aren't getting that. And I think the number one reason is just there's no standard guidelines. So they can say, well, there's no standard, there's no requirement, there's nothing that's keeping them accountable. And I don't want to get too technical, like HEDIS measures, things like that, but there's nothing that's requiring health plans to say, are you providing this service? Because it should be at no cost. And so in terms of just advocacy, this is an area that we are starting to work in this area, and starting with our Medi-Cal program in California and Medi-Cal managed care. There's a lot of advocacy work to do around this, in administrative advocacy work, and I've been following how the doula benefit's being implemented in California, and something similar needs to be done for lactation and breastfeeding support, because people are falling through the cracks. They're not getting the support, and this is such a vulnerable, frustrating time, and it's really heartbreaking, because this is about feeding your baby and providing nourishment to them. There's so much more, but I want to give Akila and Selah an opportunity. Other things will come to my mind that I have written down here, and I think there's great suggestions in the chat. WIC is a huge resource, and so is the outpatient. If a hospital does have an outpatient lactation clinic, those are great supports in the community.
I love that you're so knowledgeable, Robbie, on like the dirty side of stuff, right? Because insurance is so shady. It's just shady, shady, shady. And to be quite honest with you, this is one of the main reasons why I left private practice to get a paying job where I was on salary and payroll, because I was doing so many consults for free. And I was like, I'm going to starve if I keep doing private practice consults for free, because they're expensive. And we like to say, and I see it in the chat too, like, you know, have a lactation consultant come to their house, but is that equitable for everyone? No, because it's expensive. And I know that on average in LA County, it's about $300 for a lactation consult. I have colleagues that work in New York that are charging upwards of $500 for that. I needed a consult when I had my first son, and I was just like, oh my goodness, I can't afford this. And as a lactation consultant, we say, we will provide you with this service and give you what's called a super bill that you have to pay us upfront, and then you'll go and submit this super bill to your insurance provider. And it's up to them whether or not they're going to reimburse you for this fee. It is a nightmare because they will bounce you all around. I did this personally before I was a consultant, and I never got reimbursed for my lactation visit, because they give you the runarounds, and everybody knows if you have a baby and you're on hold, you're going to give it a go once, maybe twice, and then you're just going to give up, and then they win, right? And so just having those fees are very difficult. I love that everyone is representing WIC in the chat. I am from WIC. I'm sitting in WIC right now. And the good thing about this is you can see a lactation consultant at the WIC program. You can see me, which I would charge you outside $300 for free. Right. So that's a fantastic resource. And I think that everyone, it still surprises me that when we meet people at external events and stuff, they're not on the WIC program. And some of them haven't even heard of the WIC program. And I don't even know how that's a thing. Right. We should be providing this as a resource to everybody at hospital discharge, whether we think that they're going to qualify based on income or not. I always tell people, do not disqualify people. Don't disqualify for yourself. Let WIC disqualify you. Right. You don't know if your income is going to qualify or not, or whatever is going on at the very moment. So you should always apply for these resources and services because they are really helpful.
Selah, do you have something to share as well?
I just have a few things to add, but I agree. And I want to echo absolutely just the fierce barrier it is to continue calling back and be on hold and be moved around from place to place. That's really, really frustrating. I just wanted to chime in with a few other job protective pieces. So it sounds like Kayla at this point is probably still in the recovery period. But if she qualifies for the California Family Rights Act, which means that her employer employs over 25 people, that she has worked at her job for 1 year or more, and that she's worked at least 1,250 hours prior to going on leave, then she would be entitled to an additional 12 weeks of baby bonding time. And again, it's job protected, so she would be able to return to her job after that bonding time. During that time as well, she may be eligible for paid family leave if she's paid into the fund. That provides 8 weeks of wage replacement for people who are bonding with a new child and some other circumstances as well. And in San Francisco, there is an ordinance which requires employers in certain circumstances to top off that percentage. So paid family leave is 60% or 70% for the lowest income earners, but San Francisco requires that top off to 100%. And I will put the number to our helpline at Legal Aid at Work, Work and Family Program in the chat if you have additional questions about that.
Sayla, I have a question because I'm always confused about this, and I'm sure other folks are. So technically, what is the total amount of time that you can take off and be covered, like have job protection with all of the, I think you said paid family leave and then the baby bonding time? What is that collectively?
Sure, yeah. And I think I'll start back actually even earlier. So there's a complex kind of combination of laws that protect your time prior to giving birth and then after giving birth and recovery. And then again, if you're eligible for that baby bonding time. So typically we see people taking leave about 4 weeks prior to their due date. Before that, you are also entitled to accommodations at work. So if you need small changes to your job in particular, to be able to continue working, you should be able to discuss that with your employer, and they should make adjustments to allow you to continue working. Pregnancy disability leave, which is the law that protects that portion through giving birth, and then 6 to 8 weeks after giving birth, depending on your method of delivery, whether it's vaginal or C-section. The law actually provides up to 4 months of leave total. So that's particular to your individual circumstances. Like I said, in a typical uncomplicated pregnancy, that will be 4 weeks prior to the due date, and then 6 to 8 weeks post birth to recover. But it could be more time if particular to you based on physical conditions as well as some mental conditions. And that's something you would talk to with your healthcare provider. And so that's job protected time for birth and recovery. Then, like I said, if you're eligible, let me back up. During that period of time, if you've paid into the fund, and most people have in California, most people who are employed by a private employer, you can look on your pay stub and see if there has been deductions taken out for SDI or CASDI, sometimes it says. And if you've paid into the fund, you can apply through the Employment Development Department or the EDD for wage replacement. So a portion of your wages for that time based on your own serious health condition. Then after that period of time, your doctor will certify that you've recovered from childbirth. And if you have worked for your employer for at least a year, at least 1,250 hours, and your employer employs over 25 employees, then you would be eligible for the 5 employees. You'll be eligible for the California Family Rights Act, which provides 12 additional weeks of baby bonding time. During that time, you will also, again, if you've paid into the fund, be able to apply for paid family leave. So it's a little confusing because there's leave in the title, but paid family leave is actually kind of similar to SDI in that it's the wage replacement portion. So the portion that you can get paid while you're taking leave from work to bond with your baby. And that provides, again, 8 weeks. So it doesn't go the full 12 weeks, but provides wage replacement for that period of time. Did that answer your question?
And then some. That was amazing. Fantastic.
Yeah.
Like we need to give a virtual clap for you because you are just a wealth of knowledge. Thank you.
Yeah, absolutely. And like I said, I'll pop our helpline number in the chat. If you have questions about this, issues that come up in requesting these rights or talking to your employer, you can call our helpline, which offers free and confidential one-on-one legal advice.
Okay.
Wow. Thank y'all so much. I feel like I have like a bird's eye view, thinking about like the policy on like the federal level, like zooming in more about workplace and those benefits that a lot of people are eligible for. And then I want to zoom back into with you, Akila, that some of the kind of particulars from this part of the story, right? So like our mama, Kayla, is having like bloody nipples, engorgement, like the physical pain. I'd love to hear some of like higher level, kind of solutions that a mama would be able to do in that particular experience. But I'd also like love to hear more about some options to like donor milk and learning a little bit more about like what WIC does offer for free. So again, hearing more about like what can that mama do for the physical pain, and then what are some other resources, whether it be WIC or donor milk, that she could access for the free.
Yeah, so off the bat, if breastfeeding is painful, it's not sustainable, right? It's gonna be really difficult to go the gambit to breastfeed towards whatever your goal was, the 6 months that's recommended, 2 years beyond, whatever. It's gonna be very hard to accomplish if your nipples are bleeding, cracked, sore, the baby's not latching, physically, mentally, emotionally. If any of those things are not in place, then this is why we see our moms having those statistics that you said in the beginning, saying that they want to breastfeed. I think it was like 87%. And then we drop all the way down to 50-something%, because after the second day, when that baby's awake and alert and they want to breastfeed around the clock, but your nipples are destroyed, that's when that nurse is still there, because you're still in the hospital. And then you have that nurse creeping in saying, oh, look at you starving that baby, right? And so you look down at yourself, messed up. You look down at this baby screaming, and then they just bring you in some nice infant formula. What are your choices? What are your options? And so that's why it's really important to get that help quickly, get that help early. I know here at my organization, so I work for Antelope Valley Medical Center, Antelope Valley Hospital in the AV. We look for those moms. We look for those moms that are having breastfeeding issues. And I understand that not all hospitals have that method to work so closely and connected with WIC, but it's possible, right? And so when we know that moms are having those issues right away, they get a phone call within 2 to 3 days. And saying like, hey, this is WIC. We have peer counselors that can support you, because there are moms that have been there. Hopefully we have that culturally congruent support, which I think we're going to talk about in another scenario. But honestly, it's not there. We know that we live in a lactation desert, but if and when at all possible, getting that mom support early on. I know you also asked a question about donor milk, which is something that's really important. And donor milk is kind of, it's wishy-washy in the African-American community, Black community. I know for myself, before I was educated on it, and this is why early education is really important, I would have never given my baby donor milk. I'm being very honest and keeping it real, because if that was offered to me, I would have assumed that they were going to get milk from the lady in the room next door to me. I had no idea that donor milk was from like Havana or San Diego Milk Bank and things like that, and that it was pasteurized, because I'd never even heard of that being such a thing, right? And so if I hadn't heard of it, like, there are more Aquilas out there that don't know that donor milk is okay, and it is the second best option to mom's own breast milk, to lactating person's own breast milk, and formula should be kind of our third last option, because we want to make sure we're feeding the babies. So I'm always going to talk about the education piece. Early education is crucial. We cannot start the conversation when the mom gives birth, because at that point, in my opinion, it's already too late.
Awesome. Yeah, thank you. I think for me, I'm really centering on just, there are so many ways that we can help this mom, whether it's because we like listen to Selah, we now know all this information about like getting time off in the workplace, and we're able to offer that, or we're kind of aware of like what's going on, like the policy and helping with that mobilization, or maybe we do become a lactation specialist ourselves, a CLES or an IBCLC, so that we actually know what to do in the case, like we know about nipple guards and these things. But I'm also just thinking too, like, if that mama had a friend, or maybe her doula or someone else, maybe who didn't know about lactation specific things, but could take her to WIC, like literally transportation, so that she could get that free access. So, actually, and really quickly, this is a great question in the chat, and then we'll move to the next scenario. But there's a question about, should donor milk come from moms with the same blood type? Akila, do you know the answer to that?
I'm not an expert on like donor milk, but they don't go based on like the blood type. And you can correct me if you know a little bit more, Robbie, but the milk is collected into a huge vat and it just all gets poured in. The milk is highly screened. So they are checking for, if my understanding is correct, you can't even have like just Tylenol, right? So they want you to have no medications in your system, not be taking any herbal supplements. Obviously, they're going to do a blood test. And so it's screened and pasteurized. Yes, donor milk is pasteurized. They're not just giving breast milk from other women to babies. It is a huge process for screening and completely safe. There was a big worry about donor milk during COVID, like is COVID transferring through the breast milk? What's going on? There was a shortage of milk. And so it is, now that I'm more educated on it, safe to give to your babies and should be a choice that's given, especially to our premature babies. I'm gonna go off on a small little tangent because this is really important, that African-American children have higher prematurity rates, right? Those babies are being born early for many, many reasons. A lot of these things have to do with stressors that are put onto the Black woman's body that cause them to go into birth earlier. One of the main causes of a huge devastating disease in the bowels could be prevented based on not giving formula. So babies that are in the NICU, babies that are born prematurely should not have formula if mother's own breast milk is available and the hospital is able to provide donor milk. Okay, so that could be a difference between life and death in those babies, which we are already predisposed to because our babies are being born premature at higher numbers than our Caucasian counterparts. So donor milk is definitely something that should be an option. I know we just did a presentation. It's called the Regional Breastfeeding Consortium. You can find the recording for that training on Breastfeed LA's website. I'll try to drop the link in the chat. If you want to get more information, it was presented by a couple of our hospitals that offer donor milk, and then also by Pauline Sakamoto, who's from San Jose Milk Bank. So you can get more information on that if you work with the hospital or if you're interested in bringing donor milk to your hospital if they're not already using it.
Wow, thanks y'all so much for this very important and very integrated conversation, right, about what is available for mama when they come home from the hospital and are still intending and wanting to breastfeed, and the different supports that they can get, whether or not their insurance is on the right track, but there's other things like support from work time off, as well as accessing WIC, accessing donor milk through local milk banks. So thanks y'all. And so we're gonna move on to scenario 3.
Awesome. Yeah, the wealth of knowledge and information. Thank you so much, everyone. And I think it's just so important to emphasize the importance of human milk feeding, right? So scenario 3, let's get into it. Kayla is now at work. She's back at work and she works at a tech company warehouse and is paid on an hourly basis. She is trying to get her employer to provide her with a separate lactation room to breastfeed, and now her hours are getting cut. And Kayla knows that there is a federal protection that their employer is required to provide a separate lactation room, right? So what Kayla does is she then organizes her fellow coworkers. She partners with legal aid at work to get a separate lactation space. So let's get into kind of what it looks, sounds, and feels like. All right, so what this looks like, it looks like not having a private sanitary lactation accommodation, right? We see in our illustration that Kayla is looking at this bathroom door, like what, having to pump in a small cramped bathroom stall. Maybe it's loud, maybe it smells weird, maybe there's just other things going on. And after that, maybe trying to pump in your car if the bathroom wasn't working out, right? And so maybe it's hot, maybe there isn't privacy as well. And having to figure out on which breaks and timing it right with your letdowns and everything like that, right? Maybe it's your nipples leaking while you're working, and because of your manager and feeling pressure, or because your work shift is so busy, being unable to pump at those right times. needing to change your nipple pads or having dry nipples or anything else that might be going on with your body. And looks like having conversations maybe with your manager. Maybe they're talking to you about different things in the workplace. And maybe they're not educated around, maybe they've never had a baby or been around what it looks like to breastfeed and pump, or the equity issues around this, right? So, why are you taking so many breaks? You can do that in the bathroom. Breastfeeding at work is nasty. Yeah, I think all of these things are things that mamas have heard, right? Just noise in different spaces that, you shouldn't have to breastfeed in. What it feels like, a lot of different things, but, maybe she's uncomfortable because she has had a wet shirt throughout the day, or maybe she's had a letdown and she wants to let that milk out, right? Maybe she feels upset and almost kind of powerless by the way that the employer is treating her, where she knows that she shouldn't be treated this way. And maybe she feels like she's letting her baby down because she really doesn't want to stop breastfeeding, but feels the pressure that she may have to. And so love for folks to kind of share in the chat, like, what encouraging words would you provide to Kayla in this situation? Let's uplift Kayla, let's uplift our mama. And maybe what would you tell Kayla's supervisor, even thinking about it from the perspective of like how to have these conversations, right? How can we, like, thinking about an accountability conversation and looking at, hey, like, this is the law, right? How do you actually have that conversation with your employer where it feels like there's a power dynamic? So love to hear in the chat what folks want to share. I'll give 60 seconds. And I'm also maybe looking at time. So while folks are kind of like typing out their answers in the chat, we'll read them, we'll hear you. But maybe looking at time, I might just skip to our panelist input. I think that yeah, there's a lot here, right? So I'm gonna stop sharing. Selah. Let's go to what you have for us, because I think this is totally in your wheelhouse and your work and what you look at all the time.
Yeah, absolutely. And I want to just, really acknowledge that can be a real thing and a real issue in terms of feeling comfortable to speak up at work, feeling comfortable to, even if the law technically is on your side, of course, we know that having those confrontations with supervisors, bosses, employers can be difficult. And so I really do want to offer us as a resource. I will, again, drop the number so it doesn't get lost up in the chat, and I'm happy to share also more resources with you all as well. I want to just start with what employers are required to provide in terms of pumping. So your employer is required to provide a private place to pump that is safe and free of hazardous materials, that is not a bathroom, very importantly, that also has a place for you to sit, and also a surface upon which to place a breast pump. There also has to be access to electricity, and also not within the specific room itself, but close by to running water and refrigeration. You are also entitled to reasonable breaks outside and above and beyond your sort of normal meal and rest breaks to pump milk. And so any breaks that are, again, without those outside of those normal break times don't have to be paid by your employer, but your employer cannot deny you from adequate time to both get to the pumping place, set up your pump, express milk, clean your pump, all of those things, and get back to work. So I wanted to start with that. There also are, legal protections against retaliation or denial of these types of accommodations, really recognizing that it's hard to have these conversations. So again, the law is on your side, and please feel free to reach out to us for further support.
Yeah, and
Hey,
oh, go ahead.
I add to that too, that they also need to have a policy, a workplace policy that states those elements and of what they're going to provide. And so that's a good place to start with, asking for your workplace policy around supporting lactation in the workplace. And that's required for all employers in California. San Francisco has some, well, the state law is based on San Francisco, but San Francisco does have some special protections compared to the rest of the state.
Absolutely. Thanks so much, Robbie.
And just a suggestion too, don't wait until you're back from leave to have these conversations with your employer. So chances are, if they are not set up to help you, and it's like, okay, you've been there already 3 hours, and you're like, oh, I gotta go express. It's been the 2 to 3 hour mark. It's not like they can just go throw something up for you, and then that's going to be a whole problem. So the best thing to do is to have conversations with your employer before you go on leave, to ensure that when you come back, everything is set in place, or if there's going to be a battle, that you fight that battle beforehand, because it's going to be just really difficult for you to get back into the swing of things, and on top of being emotional because you just left your baby at home. So that's just a suggestion, to make sure you have the conversations beforehand.
That's such a great suggestion. And I also just wanted to add one more thing, which is I think in this scenario, this person did organize with other coworkers, but it really is important for any and all people who run into this situation at your workplace and in the future. So you can really make a difference also by having these conversations.
Absolutely. And go ahead, Robbie.
I want to tell someone, just legal aid at work is a wonderful resource. Like, have that 1-800 number there to give to people, because they do call them back and can answer the legal questions, which is really important, and help to facilitate any complaints, because that's part of the problem. Is the onus is on the lactating person. So if it's not going well in the workplace, you have to make a complaint, and that takes a lot of courage, but it does work. I have seen people complain and they've been successful, and you can complain through the Department of Labor, the Federal Department of Labor, especially if you're an hourly worker, you have protections, and then the state department with Bureau of Labor Enforcement. Is that what it is, Sarah? The labor commissioner, but they can help you with that process. The Department of Labor, it's getting on the phone. I've helped someone when I was at a WIC program do that, and they went out and did an investigation. And this was at a farm, and because they were having the mom pump in the bathroom, just like kind of this scenario. And then their other solution was, oh, well, you can go to the owner's house of the farm. You can pump there. And she's like, no, somebody walked in on her in the bathroom, and she was just mortified. And just like that picture, balancing the pump on the sink in the bathroom. And her sister's like, no, come on, let's go to WIC and we'll ask them for help, and we're going to make a complaint. And so the Department of Labor went out there, and the workplace found a solution. And they had another office that she could go into and pump, and she went back to work, and everything worked out. So we got support.
Those stories are so powerful, and it's so important to hear, right? So important to hear these successes and being able to execute your rights. And I think that I want to encourage people who maybe aren't lactating, or maybe never will, ask your employer about what are the laws here. What are your breastfeeding lactation policies? Because it shouldn't just be on the mama, right? This should be something that we all care about, people in our community who may be breastfeeding, right? And it's a structural, we need to find these structural solutions to make change. So thank you all so much. I want to see if there's anything else that our panelists want to share. Otherwise, for the interest of time, we may move to scenario 4. Thank you. And actually there's one more question that I'll ask really quickly is, how can employers remove the responsibility from the employee? And is there any guide to help maybe employers figure this out?
That's a great question. And our organization is focused on workers, but I totally agree with you. And I think it kind of speaks to what I was saying before, is that sometimes employers really are not even acting in bad faith necessarily, although we do see that, of course, but people really need to be educated about what is appropriate, what the laws are, and what they are required to provide. And so I think, employers should be also wanting to find this information and wanting to figure out how to best comply with the law. And certainly we have, fact sheets and other information on our website that is sort of geared towards workers, but has information that could be applicable to, information that can be informative to employers as well.
Awesome. Thank you.
We will have a guide for employers coming up probably in the next few months, but the Office of Women's Health does have information at the federal level and examples, and there's some really good videos, and I can put a link to that also.
Thank you so much, Robbie. Everyone is incredible. Okay, so we're gonna move on to our final scenario, and I'll pass it to Joe.
Awesome. Thanks, everyone. So this is, like Selena said, our final scenario, just kind of wrapping up the story in Kayla's journey so far. So after successfully getting her employer to provide a separate lactation space with the help of legal aid at work, the mama, Kayla, is super excited to further assist with future national and state policy work. You can see her in an illustration at giving a presentation. Next slide. So yeah, what does this look like? It might look like the mama going up to the Capitol, and the mama, maybe she gives some testimonials at hearings, and it looks like her being heard. Next slide. What does it sound like? Your voice and experience is welcome here. Thank you for making an incredible impact on our communities. And what might that feel like? I really want to pay close attention to this slide, right? Because when we started, our mama was in the hospital and struggling, and it's just loud, and the nurse, these experiences Akila shared with us of nurses just being really disempowering. So fast forward, and we see that our mama Kayla is feeling seen, heard, and valued. And very importantly, she's also being supported by organizations who care. So it's, again, not just on her. It's also this experience of really being supported and cared for and uplifted by other organizations, by other birth workers, etc. So for the chat, and then also when we go to our panelists, we're really proud of our mama for this whole journey and kind of seeing how she progressed and found her voice as a first-time mom and all of these things. But we also really want to say as well that it's not all on her, and that's what we're kind of talking about when the panelists were just speaking for scenario 3. So in the chat, I'd love to hear from folks about who else should get involved in policy and advocacy, who else in addition to the mama should be up at the Capitol, who should be advocating. And I'd also love to hear from you all about what you think community care might look like. So I think we've talked a bit about this, right? That it might look like, more Black folks getting trained as lactation specialists. It might look like this Kayla and other mamas joining stuff like Breast Friends, or other breastfeeding local groups. But yeah, I would love to hear in the chat, what does community care look like for Kayla and for other mamas? And so I've referenced this Breast Friends Oakland. Thank you so much, Lakia, for this is their Instagram. They host mommy meetups. We're also seeing the Office on Women's Health, which will give us that resource about supporting nursing moms at work. So yeah, if you guys have community resources, please put them in the chat. We're so appreciative of these things. And yeah, so opening it up to the panelists, I would just love to hear, especially from you, Robbie, but everyone else as well, like, what does that look like? What does advocacy look like? How can the community become involved in advocacy?
Well, we have a lactation action network, so I'll put the link in there. I invite everyone to join that. Our goal is to have community members build a relationship with their legislators, so state and federal, and to educate them about the issues in their community around lactation and breastfeeding. So exactly kind of what we're doing today. And we do visits at the Capitol. Right now they've been virtual, but it's organizing. And so anyone can be involved. Our goal is that when we engage in any other future legislation, that people who are directly impacted by the issues are the ones creating the solutions as well, and those sub-policy solutions. Very often, they're not included. You know, they're created, people are well-meaning, we know the issues, but people who are directly impacted really need to be part of that process. It just makes it so much stronger. And I think legislators are more likely to listen too. You know, they're listening to lobbyists all day, but when real people come in and their constituents, sure makes a difference. And I've seen that in action, where somebody comes and tells their story and the legislators have come up after and thanked them for sharing their stories, and it makes a huge impact. So your voice matters.
Thank you, Robbie. And I love that. I think that finding ways so that it's not tokenizing, but really is empowering and being led and giving people the resources that they need so that they can actually be present with that work is so important. I know that we'll be kind of wrapping up this part because we're ending in a few minutes, but Akila and Selah, did you guys have any remarks or any last words that you wanted to say?
Yeah, really quickly. I always like to say that just because it's not a problem to you doesn't mean it's not a problem. And so if you are like, I'm never having any kids, that's not me, or I've already had my kids, you know, I'm past that. You still need to like speak up, support, advocate for these things, because you never know if it might be your child that's working for this new job, whether you're working for WIC or in a hospital or a business, whatever it may be. We have to support each other. For businesses, I think it's really important that if you wanted to support and you're like, I'm gonna write for this, you know, breastfeeding supported here, breastfeeding welcome here, decals in your store window. We put up so many nonsense things. Like, let's start putting up things that actually matter. And then also, if you are not able to like go out there and advocate and do all those things, donate to your local coalitions. Donate to small businesses within your area that's trying to support breastfeeding. Volunteer if you can. At bare minimum, if you are out and about in the mall or wherever and you see someone breastfeeding, give them like a I see you, or a wink, or just like a thumbs up of encouragement, a pat on the back if you can, like anything that shows that mom that it's supportive and what she's doing is normal. We can work together to normalize breastfeeding. And then it's like, I'm all down for girl power, but the men also need to get involved. We need to have more men getting involved. And I am huge on this. My son is going to represent breastfeeding because mommy's gonna make him. And you know, teach your boys young. Talk to it about your husbands. When I first started breastfeeding, my husband was like, "I know you're not about to like whip it out right here in the middle of the mall," and I was like, "Yes, I am." And so now, like when I had my second child, he was like, "You gonna feed her?" right? It was almost like he was trying to get it out. I couldn't get it out fast enough. He's telling me like, please go ahead and like give her this breast. And so it's so simple how you can really change things that quickly by just doing things, showing that it's normal. So let's get these men involved because I hate to say this, but they still do make a difference, especially in the workplace and when we need to get policies and things changed because somehow they're still at the top. And if they are on our sides and they see that this is a huge benefit to not only our children, but our futures, then hopefully we can see a lot more change happening.
Thank you. And Selah, do you have any like last remarks?
Yeah, I would just echo everything that's been said. It's been such a joy to be here and share the space with the panelists and all of you. Wonderful questions. And I totally agree that your voice matters. You know, legislators and the people at the top, they work for us. And so we need to have your stories and your voices and our voices, you know, our collective community voices heard to effectuate these laws and policies for the better, for the world that we all want to live in, for our children and for ourselves.
Awesome. Thanks y'all so much. So I'm going to pass it on. I think it's to Peja to go over a few of our last resources, and we have a couple shout outs to give, and then we'll be closing.
Yeah, thank you, Joe, and thank you to our beautiful and wonderful panelists for all of your input. We're going to run through this quickly so we can get you guys out of here on time. So we're going to share a few resources and also do a closing. So next slide, please, Selena. Okay, so these are resources. So this is actually taken directly from the Expecting Justice website. So if you go to our website, expectingjustice.org, and you click on our resources section, and it's divided by provider, advocate, and also mamas, you can see breastfeeding resources. And these are not only specific to the Bay Area, though, of course, we are partial to the Bay Area. They're California-wide and also national. For example, we have the La Leche League, and that's international. And then obviously California Breastfeeding Coalition. We have the wonderful Robbie here with us, representing them today, and also the Mother's Milk Bank. But these are just a few resources that you can get connected to, whether you are a mother or whether a mama, or whether you're trying to get more resources for mamas in the community. Next slide, please.
Awesome, and I'll take this one. So I wanted to give a quick shout out to a mama in our community named Teresa Fortune. So Teresa is a filmmaker and as well as an artist and a mama from the community who created a documentary that really documents her journey being a mother, even through postpartum depression and experiences with like not being able to breastfeed and these like longer term effects that this long-term kind of healing journey has had for her. And so with this documentary, she actually does filmings and showings for organizations. And she also has some like artwork as well that accompanies it. So definitely reach out to her to learn more about her documentary. And if you're interested as an organization to like have a showing for her documentary, or coming in and kind of like giving some programming around it as well, like you can hit her up at hello@fromtheashes.media.
Thank you, Joe. We're going to head into our closing. You could scroll past the thank you. There's an action slide. Okay, so how can you take action after this collaboratory? We don't want you to come and this is just another event that I went to. No, like actually taking action. Akila, Selah, and Robbie spoke to this a lot about ways to be involved. So one way is to vote. Like the policies that we're speaking about today, especially that Selah and Robbie are speaking to, like folks had to vote for those to come into fruition. There are going to continue to be breastfeeding and chest feeding policies that come onto the ballot. Please, 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 please vote. Donate to your local orgs, donate to your national orgs, donate to the local IBCLC or the local CLES who's out helping the community and doing like Akila used to do back in her heyday, which is providing services for free. How great would it be if you could sponsor a local CLES to be able to provide lactation services to a Black mama in the community? Change policy. And this is not just at the state or at the national level. This is also within your own sphere, right? So within your work environments, right? And also within your local hospital systems and clinic systems and insurance, right? And insurance systems, right? Look at changing policy and how can you get involved with that and make policies that make it easier for Black breastfeeding mamas to breastfeed. Another thing is to be a resource. Like we have shared so many resources today. They have been in the chat. People have been talking about them. I'm sure you've clicked on them, downloaded things, all of the things. We want you to leave here being a resource, right? Like at the minimum, you can, hey, I actually just learned about the California Breastfeeding Association. Hey, I actually just learned about Breast Friends Open. Hey, I actually just learned about La Leche. Like, right? How great would it be to be a resource within your community for Black breastfeeding mamas? And last but not least is to create racially specific programs. It's not enough just to create a program for all breastfeeders. We're here to talk about Black breastfeeding in specific. The things that we need are specific to our community and specific to our culture. Therefore, the program should be specific to our community and specific to our culture. So when the next time you're in the space, right, and you're thinking about creating this program, make sure that it's racially specific and that you're not only that, but you're bringing in Black mamas from the community and Black community members to inform, right, the procedures and the goals and the objectives of that specific program. So please, please, please take a screenshot of that, save it to your phone, and continue to think about it after. And we just want to say a huge, huge, huge thank you to all of you for joining us today, all of you who stuck on 3 minutes after. We thoroughly appreciate you. A huge thank you to our panelists. You were all amazing. I learned so much. You are all amazing, but it was truly, truly a pleasure. And also a huge thank you to my co-moderators. You all were awesome, and to our ASL interpreters, and also to Lakia. Thank you so much. It was truly a pleasure. We hope that you have a great remainder of your day. Bye, everyone.
Thank you all so much. Bye-bye. See us next time at our next Collaboratory.